Welcome back. 7:23 right now on the Health Watch this morning. The growing interest in eating healthy can have some unhealthy consequences, especially when eating a clean diet becomes an obsession. Some local doctors say they're actually seeing patients who arrive malnourished to their appointments because they're trying to keep up with all these diet trends. The problem is they cut out entire food sources like gluten or dairy or sugar, and they end up hurting themselves more than helping. Physician and national mindful living expert Dr. Romie is joining us this morning to talk more about this. Great to see you as always,
morning,
Dr. Romie. Thanks for being here. This is fascinating because it is the opposite of what you would assume. You assume if you are going to start dieting in a way that is extremely healthful, organic, and fruits and vegetables, that suddenly you are going to be magically healthy, and that's not the case.
Well, this is. So what you're discussing is having a balanced diet of healthy foods, and you and I discuss that often together here, and that is healthy eating. What we're talking about here is a psychiatric disorder called Orthorexia Nervosa. It's an eating disorder, and what's happened is people take this clean eating, like raw foods, whole foods eating vegan or vegetarian, to the extremes. It's often related with people who have a history of anorexia or obsessive compulsive disorder.
Okay, so when you eat a diet like that, what are you then missing? What are the things that you're missing that could cause you to become malnourished?
It is. You know, so what's happening with clients that we're seeing and that these medical journals report is that they are cutting their calories down to the extreme so that they are having rapid weight loss. In that process, they are losing valuable nutrients, the ones that we discuss all the time that we need: protein, omega-3 fatty acids. Often because they've cut major food groups like meat or protein out of their diets, they also are deficient in iron and the vitamin B complexes, B as in boy.
What are some of the symptoms or signs that you see when these folks come to your office?
Believe it or not, the mood disorders, the psychiatric symptoms are the first things we see. People tend to be more anxious, they can't sleep, they are feeling depressed because of a lot of the deficiencies we see. Now, as it progresses further with the rapid weight loss, they're feeling tired and fatigued all day, uncontrollable headaches and migraine headaches. My background in neurology, when I see people that are going to the extremes like this but then let's not forget the underlying mood disorders. They've become antisocial. They refuse to go to any restaurant or parties because, you know, nobody has clean enough food for them to eat.
Wow. You know, we hear this all the time, but people who just decide they're going to start a gluten-free diet. But gluten-free is for people who have celiac disease. Is that right?
That's a very good question. Yeah, I actually do eat gluten-free. There are about 1 in 100 people in the United States have celiac disease. It's an estimated about 40% have gluten sensitivity. You need to be tested for that. So before people just start largely eliminating large food groups out of their diet, go in for a food sensitivity testing. We do a broad one at the Center for Natural and Integrative Medicine that tests for 96 different foods. So before you just start using one of those one-size-fit-all diet programs, sit down with a healthcare provider. Let's assess what your symptoms are, what your end goals are, and do it in a healthy and balanced way, Amy.
Wow, it's great advice for everybody. We don't have enough time to get to all of it this morning, but how can people reach you if they want to get more information?
Absolutely. Go to www.brainbodybeauty.com and reach out. We're always here to help and get people healthy.
All right, you're awesome. Thanks, Dr. Romie.
Thank you,
Appreciate your
Amy.
time this morning. Great information. John, let's send it back to you.
All right.